I'm back with my new video that is on the assessment of binocular single vision. In this video, you all learn about how you can assess the binocular single vision anomalies, and with that you can understand about different types of test interpretations. With that, I have mentioned some questions to that I have asked to you. Please answer that in the comment section by numbering them 1, 2, 3 answer, and there are 4 questions, so please answer them. And with that, I would like to say that show your skills by answering the questions, and see this video fully so that you may understand about each and every test which I have mentioned and which is useful to our daily optometric field. Okay, so this video is going to be very worthful for all of you, so please watch it. One thing more, that I provide the tutorials for ophthalmology topics that should be very useful for the students who are willing to take the videos on their personal topics. So please contact me for that. I have mentioned in the description column for the contact of contacting me for the personal tutorials by me to you. So hope you all like this video. So the assessment of BSV includes the things further we know about it, but firstly we need to know that what we are going to assess. We are going to assess the binocular single vision anomalies. Okay, so in this we will understand that how we can assess the suppression, how we can assess the amblyopia, and how we can assess the abnormal retinal correspondance, how we are going to assess the diplopia. So these are the things we need to assess for binocular single vision. The suppression is being tested with the worthfourdottest, with 4 diopters base out prism test, with Redglasstest, and with the Synoptophore. So these 4 tests are going to judge or going to examine the suppression having by a patient. Okay, so in these, first we learn about the and by amblyopia we are this is going to be tested by reduced visual acuity test, crowding phenomena which judge the visual acuity or amblyopia, and with the color vision. You will further know about these things. I have mentioned that. And with the abnormal retinal correspondence, that is being tested with the worthfourdottest. As you are noticing it, that major common tests are there. Okay, so ARC is being tested by worthfourdottest, Bagolini's striated glass test, after image test, and with the Synoptophore. Okay, so these are the things for ARC. Now the diplopia is being tested with red filter test. You will came to know about the interpretation in the further slides. Worthfourdottest, 4 diopter prism base out test. First we are going to learn about 4 diopter base out test. This is the normal ray optics of an eye where we are focusing to a one object on our both eye fovea. Okay, but whenever we place a prism in front of a eye, then what happens? That prism or that ray get deviated towards the base. Okay, base of the prism. So we have placed the prism in the right eye, and we are seeing that there is the movement of eye like this. This eye get move here and this eye get move here. This. Okay, this eye also move here and this eye also move here. So what's the direction of movement? This eye moves medially and this eye moves laterally. So the levoversion occurs. That indicates that the absence of foveal suppression is there in right eye. Okay, because both are moving, so there is no right eye suppression. If this get like this, if the right eye get moves here and the left eye moves here, and with that it get again refixation movement is there. Okay, it means this eye getting moved here, and after that the eye will take its original place. After this the eye is taking its place, its original place. Then what happened? There is no left eye suppression. If there is no movement of the left eye after seeing the movement in right eye, then the right eye suppression is there. Okay, this eye is going to be straight and this eye is having a movement. After placing the prism here, then the right eye suppression is here. But if there is in the left eye, what happens whenever there is a no left eye suppression? What happens? It will refixate, na? But if this refixation is absent, then what happen? The left eye does not refixating, then the left eye suppression is there. Okay, so this is all about the suppression technique. Okay, how we can test the suppression? By what? By the 4 diopter base out prism. Okay. Now, the red filter glass test. Red filter glass test is, by its name only we can understand that we are placing a red filter on the eye. Okay, so we are placing it on right eye, suppose, and after that we are putting a torchlight to the patient, showing the torchlight to the patient. And after that, what happened? How you can judge it? You can judge it by, as the patient will see the 2 lights fixation. Okay, so that 2 light fixation is the red light and the white light of torch. Okay, so that makes fusion for pink and orange color. And if the patient is seeing pink and orange color, then the patient is having normal BSV, binocular single vision. But if there is only white light seen, what happened? We have placed the red filter in right eye, na? So the patient should see the right eye, the red light, but the patient is not seeing the red light and only seeing the white light. Then what happened? There is right eye suppression. Okay, but if the patient is seeing only right eye red color, because we have placed the red filter in the right eye, so there is an absence of white light and the patient is only seeing the red light, then the left eye suppression is there. Okay, now for diplopia. Diplopia is whenever the patient is seeing with the red filter in one eye, like suppose on red eye, then what happen? If the patient is seeing the red light, we need to observe the direction of the lights. Okay, so if the red light is in this direction in the right eye, in front of right eye, and white light in front of left eye, then what happened? There is a diplopia having exo. Exo means divergence. Okay, and if the patient is seeing white light in front of red eye, there is a crossed one, na? This get crossed. This is uncrossed and this is crossed. So the white light is in the front of right eye and the red light is in front of left eye. Then what happened? There is a diplopia ESO condition. So ESO is convergence. Okay, so these are the things we need to learn about the red filter test. Diplopia interpretations. Now we are going to understand about the diplopia interpretations that are being judged by worthfourdottest. So if we see the 4 dots as you are viewing the image, it is 1 red, 2 green and 1 yellow or white, you can say. The condition is 4 light whenever we see without manifest squint, it is the normal eye. But if we are seeing with the manifest squint these 4, then there is abnormal retinal correspondence. Okay, these are the some common tests we are going to learn about by worthfourdottest. So if we are going to see the 3 green light and 2 red light, then what happened? This is a diplopia condition. And after this we need to learn about uncrossed and crossed diplopia. In uncrossed, you are viewing the image, there is in front of right eye the 2 red image and in front of left eye there is 3 green images. 3 dots, and in crossed it is opposite. In right eye we are seeing the green dots, and in left eye we are seeing the red dots. Now the third condition is vertical diplopia with hypotropia. This can be viewed in a vertical way. The red dots are in the above and 3 dots of green are in below. Then the right eye suppression. How we can judge by right eye suppression? Whenever we only see the 3 green lights, and in the left eye, if the left eye is getting suppressed, then we see only the 2 red dots. Okay, so these are the diplopia conditions by Worthford dot test and suppression also. So now the synoptophore. Synoptophore is, as you all know, it is a device. In today's era, we won't use this much, but by this we can find out the fusion, the simultaneous perception, and the depth perception. By synoptophore, we can also detect the ARC. So if we are observing that the objective angle is greater than the subjective angle, then it is a ARC condition. Okay, so the factors by which it shows that the patient is having amblyopia. Okay, so these factors include the visual acuity as well as the color vision. Whenever you judge the visual acuity, you can see that there is a reduced visual acuity in the eye of patient. Okay, and whenever you are going to judge with the crowding phenomena, you should use the single chart letter if the patient experiencing the multiple chart phobia. Okay, so whenever the patient is experiencing any kind of phobia with the multiple chart, you can test it for the amblyopia examination. Okay, and with that you can judge that there is a crowding phenomena, and after that you can check the color vision also. Whenever you see that there is a color vision affection with the visual acuity of having 6/36 by the patient, then it is considered with the amblyopia case also. Okay, so we can further go on for the amblyopia examination. So these are the things we need to learn about the amblyopia examination. Now the abnormal retinal correspondence. These can be tested with also the Bagolini-Striated and with that you can see that whenever we are making a Bagolini-Striated test whereby the patient, and after that we can see that this is having in the right degree there is 45-degree glasses, and in the left eye there is 135-degree. As you are seeing in the image, whenever there is a cross section, the BSV is present. Whenever there is only the whenever there is only the this kind of image, this kind of line which is in the right eye glasses, then there is left eye suppression. And whenever the line is seen which is visible, which is on the left eye glasses, then there is only the right eye suppression. And if the line is seen like the upper triangle and the lower triangle as you are seeing in the image, then they are not bisecting with each other, then it is abnormal retinal correspondence. As in the second image, you can see that there is a normal BSV whenever the torchlight is seen in between the cross section of the two lines, then there is normal thing, and if there is a one line, then there is suppression and the dot is seen in the middle, and with the ARC the two lines are not bisecting with each other. Okay, and after that there is ESO and EXO also, you can see in the image. Now the after image test. After image is whenever we get the whenever we test the after image test, there is two kind of images, the positive and the negative. The positive is the sign of normal eye, but if there is a negative image, what kind of negative image I am talking about? Whenever you see the object image, then there is another image in besiding or in back of that object image, then this is called a negative image with irrespective of colors. Okay, then this is after image test.